There was very little time for any kind of collective grief, attention to bereavement, and attention to loss.
As the Ebola epidemic escalated in Liberia in the fall of 2014, the Carter Center supported Liberia's Ministry of Health and the World Health Organization in the rollout of psychological first aid to devastated communities.
Not being able to touch people, not being able to comfort people, not even being able to touch children because they may be contacts. These are all things that are very, very hard to endure. And so having the psychosocial and mental health capacity to match the horror of this kind of disease was really, really important. And we had mental health clinicians that were already trained and could right away enter Ebola treatment units and provide those services.
These mental health workers are among the more than 160 clinicians the Carter Center and partners have trained since 2010, when the Ministry of Health invited the center to help create Liberia's first sustainable mental health system.
The Carter Center partnership has helped us to get a lot of training, and this training has also helped to facilitate the training of other people who are hopeful themselves today, who can now come forth and begin to do just what we are doing today.
And crucial to the work of the partners are efforts to educate communities about and combat the stigma that surrounds mental illnesses.
Initially, there was a lot of pick people off the streets and put them somewhere, lock them up, keep them out of visibility, essentially. And now there's much more understanding that people can be treated, they can get better, and they can go back to work and they can function well.
As the Carter Center continues its mental health work in Liberia, Ebola is under control, but the aftermath reveals massive psychological scars, especially among children.
Those children who were orphaned, but also those children who were affected because Ebola happened in their communities, because they were unable to go to school because of Ebola, because they lost loved ones because of Ebola.
Recent funding from the World Bank will help build a workforce to heal these wounds.
Having clinicians that are trained in child development, including play therapy, art therapy, is really going to be critical to moving forward for many of these children.
And critical to moving forward for all of Liberia.